Welcome to another episode of the Reboot Chronicles, a no-holds-barred forum with global leaders, authors, entrepreneurs, and CEOs about how organizations stay focused on growth and innovation in unprecedented times. I'm your host, Dean DeBiase, coming to you live from Reviv's North American headquarters in Chicago, and we would like to thank you for joining us from around the globe today. I'd like to welcome Naveen Jain, good friend, investor, philanthropist, and serial CEO of a bunch of private and public companies, including Viome, which we're going to talk about today. Where are you there, Naveen?
Well, it's in the British Virgin Islands. Beautiful sunny day.
Oh, beautiful. Gorgeous. I'd like to switch places. I'm still quarantining out in Colorado, but all right, well, let's start out with some data as usual here. Since we're going to talk about all types of health and life issues today, I thought we'd do a little synopsis of life and health and maybe some death data just to kick off a Monday. So, quick update. Leading causes of death currently, which we'll get into later, are heart disease, cancer, COVID-19 now has popped into the number 3 spot, stroke, and Alzheimer's. There you go. There's your wake-up cup of coffee there. Let's talk about life expectancy. Global average life expectancy, good news is it increased by 5.5 years between 2000 and 2016, the fastest increase since the 60s. So that's nice. It does come down once in a while, but it's going, the trajectory is good. The current life expectancy in the US in 2020 is 78.93 years. Why they couldn't just make it 79, I have no idea, but that's how data works. On the health and wellness front, a couple surveys have been out recently this week. One Minitel one says 77% of U.S. adults report that they are actively trying to improve their health in some way. So we'll get into that. 60% of 25 to 44-year-olds are actively taking supplements and basically will continue to. With the Revive Beauty Index, we have been seeing the trend going up for healthcare products, supplements, and skincare products. Over 200 to 300, 400%, depending on the product category we're talking about. Our technology groups around the world are also kind of supercharging health and wellness. One of them here is with us, of course. Things like smart wearable products are predicted to continue to double. It should be about a $27 billion market in 2022. We'll see if that's helping. And then lastly, by 2023, the global air purifier market, pretty much the things you put in your home, is going to be a $33 billion market. I probably should have gotten into that one. And it also may explain a strange thing. There's a popularity in houseplants, direct-to-consumer houseplant subscriptions, where people just want to have their air cleaner, or maybe just something pretty to look at. Who knows? We'll get into that. But Naveen, I thought we'd just kick off with you. As I was talking there, I was reminded when we first met about 10 years ago, I was interviewing you on a panel at Kellogg School of Management in Evanston, Illinois. And by the end of the interview, I thought I was being interviewed by you. So I totally lost control, apparently, under that one. But great to have you back here. Thanks for coming.
Well, Dean, I think you don't want to have a repeat of that again, do you?
Oh, I don't know. We had a good time. There's one thing that you and I do is we get kind of to the raw data about what's behind decisions that are made. And quite frankly, with Viome, I think you've got a really fascinating product here. And one of my questions is, why did you start the company? Why did you pick this? You've done so many companies. You could have done anything. Why this one?
Because I think, first of all, we living in this world where every one of us in our lifetime is going to suffer from a chronic disease. And to me, there was no better problem to solve than to make a chronic disease truly a matter of choice, not a matter of bad luck. And, the thing that we didn't talk about that, the chronic disease is not something people think of regularly, but these are the diseases like obesity, diabetes, depression, anxiety, cancers. I mean, all of these are really the chronic diseases. And one would argue that one chronic disease that kills every one of us is aging. And aging is nothing but a chronic disease. And what if we can make a chronic disease optional? And that was the fundamental belief, was not just for all of us and our parents. I mean, imagine, why would you want to have your children and grandchildren suffer from a chronic disease? And to me, that was big enough problem that I want to sink my teeth into and solve that problem.
That was a great motivator. But can you really make illness optional? Because if so, sign me up for that.
And answer is 100% because there is absolutely no reason that we should have a chronic disease. I mean, think about it. You're not
Yeah.
born with them. I mean, it's a lot of us talk about these genetic diseases, and
Right.
all these chronic diseases are not genetic diseases. You're not born with them. I mean, when you, in fact, you look at your DNA, and when you gain 100 pounds, which as some of us have gained, your DNA does not change. You get diabetes, you get depression. None of these things ever change your DNA. So our fascination with our genes has been completely in the wrong direction. What we really are is a ecosystem, a live ecosystem. There's an ecosystem within us, and there's an ecosystem outside us. And as we start to destroy the ecosystem outside us, and moreover, destroy the ecosystem inside us, that is the fundamental reason why we have these chronic diseases. These are lifestyle diseases. And there's absolutely no doubt in my mind that in the next 10 years, we would have conquered the chronic diseases. Just like, I mean, even now, the COVID-19, we somehow believe this infectious diseases are going to be the way of living. But people forget the last infectious disease that actually was a pandemic was 100 years ago. So it is not something we have really good control. That size.
Of that size and scope.
Yeah. So we have really taken good control of infectious diseases.
Yeah, actually, it's hard to talk about that right now based on what everyone's seeing in the environment. But yeah, in terms of a world, it could have been 100 years of nothing but pandemics. Science has solved so many things. Two things. You have something called gut intelligence. What is that? And then also maybe take us through how does this work? What do I do? I go onto your website and I'm curious to how does this, just give me a snapshot of what's the consumer journey like?
So, we started Viome for a very simple reason. We believed that for the first time in the human history, we now have the technology at our disposal that can digitize our human body. That means we can look at everything that's happening inside our body at a biochemical level. So now we started with the gut. And the idea was there are 40 trillion microbes living inside a gut. Just think about it.
40 trillion?
Trillion microbes living inside a gut.
What could possibly go wrong? Wow.
And now imagine these 40 trillion microbes, they produce almost 99% of all the genes that are expressed in the human body. So the DNA that we get from our mom and dad, they express about 22,000 or so protein coding genes. And these microbes in our gut are producing somewhere around 2 million to 20 million genes, right? So think about that proportion. So our thinking was, what if not understand what these microbes are in your gut, but actually understand what these microbes are actually doing and what are they producing. And that was the breakthrough that every single company that in the past has looked at, they were focusing on asking the wrong question. As you and I in the past have talked about, as an entrepreneur, the best thing you can ever do to build a successful company is to ask the right question, not necessarily to have the right answer, right?
Right,
and everyone was asking the wrong question. They were looking to say, hey, I want to know every microbe that's in your gut. And I said, that will never solve the problem because the same microbe can be producing a completely different thing in someone else's gut than your gut. And by the way, there could be millions of different organisms producing exactly the same thing. So two of us can have the same disease and we would never know what's causing it if you're simply looking at the organism, or the same organisms may be doing completely different things. Just like you and I don't know about you, Dean, but when I'm at work, I'm an entrepreneur. When I go home, I'm a goddamn dishwasher. What changed is the environment. I don't change. The environment makes me do different things, right? And that's literally what organisms in your gut, they may be producing something really good. In my gut, they get nasty and produce some really shitty stuff.
I've never seen you wash dishes, by the way, ever. So this is like wellness as a service, in terms of a category. You call this wellness as a service? What is it?
So basically what we started out was to understand every single thing that's happening inside the gut. So we send you a kit. So you go to our website, viome.com. That's V as in Victor, IOME.com. By the way, you know the Indians cannot pronounce the word we, right? So I just may as well spell the damn thing because everyone said, what is that Viome that he keeps talking about? But that's we. Right?
We'll put the link on the podcast.
I know that. So my point is you go there and then you sign up. And what we do is we send you this kit. And in that kit, there is a small tube. You put a touch of a stool in that kit, shake it up, there's a prepaid envelope, you send it to us, we analyze your stool, and then within next 10 days on your app, we tell you everything that's happening inside your gut. What is your LPS level, your butyrate level, but most importantly, we tell you what to do about it. So we say, here are the foods you should eat and why. Here are the foods you should avoid and why. And here is the most important part. And now we are going to be developing the precision nutrients based on what's happening in your gut. We'll be actually designing the supplements just for you, made to order, one capsule at a time just for you. And that is going to be launching on June 15th. And that's going to fundamentally change everything. So people are spending trillions of dollars buying the stuff on faith. I hope it works. So they join the church of vitamin D. They join the church of this, and they have a faith that it somehow works. Our thinking is that in the world of science, you don't have to have a faith. So thing is, we measure it, we see exactly what's going on, we give you what you need, exactly what you need, and nothing that you don't need, and then we prove it to you that it works. You can see your scores actually change, and that's how it should be. It's a closed loop cycle. And the other thing we're doing in the next 2 weeks, brother, is launching something called blood transcriptomics. For the first time in the human history, we'll be looking at not your genes, but every human genes that are expressed in your blood. So we'll be looking at your mitochondrial genes, your energy, your mitochondrial biogenesis, stress response on your cell, all the inflammation in your body that's going on, every single cellular health, your biological age, and combining all the data from your gut and from your body. And then we're going to be looking at the same thing on your saliva to look at the oral microbial activities. And here's very interesting. We just started doing the oral microbiome, and we filed with FDA that we can now detect oral cancer with 91% accuracy just by looking at what your microbes are doing in your mouth. So think about it for a second. Right? And that to me is a key to understanding human diseases, is to understand what's happening inside the body. And I believe for the first time, not only will we be able to understand it, we can go back to what we knew 2,500 years ago to use the food and nutrition as a medicine. So every doctor takes a Hippocratic oath, and they forget what Hippocrates actually said. What did he say? All diseases begin in the gut. Right? Let food be thy medicine, let thy medicine be the food. And one man's food is another man's poison. That means there is no such thing as kale is good for everyone. Kale is actually bad for me, and I'm so happy for it.
Yeah, you're lucky. My doctor said I should eat it. So, and we have an episode coming up on the food is actually medicine with Monotree Partners, which would be fascinating. Let me just back up the bus a little bit. So. I can take the test, but I could go two ways. You could tell me what foods I should eat and not eat based on my gut. And now you're adding to that customized, personalized, so let's just call them supplements. Hopefully it'll be a little bit better than that. So at Revive, Revive is a skincare diagnostic selfie app. You take a picture, it analyzes a lot of deep AI in the background. And what we're learning is, what do you need for your specific skin type? But where we want to take that next is not just what you should put on your body, but what you should put in your body. And I like that you're doing multivariate testing, because I think it's important to kind of maybe corroborate it from different angles. But we're seeing a trend with consumers, not just in the COVID era that everyone loves to talk about right now, but even before that, where there's just this heightened use, as you saw in the data I presented, this heightened awareness of self-health, of wellness, and how do I take care of myself? And like you say, how do you also look good? So you look pretty good, but is that because you're in the British Virgin Islands, probably?
And I'm
no
also
stress.
I'm also 60 years old, and that life is good. Right? But really, honestly, what your mother said was probably right. What did she say? The beauty it comes from inside, and that's literally true when it comes to your skin. We now see when people do a gut test and we actually reduce the inflammation in the gut, what we see is people report their acne is gone, their eczema is gone. They don't have they don't know dry skin. And to me, those are all the disease of inflammation. So just to add to that point, the chronic diseases are caused by chronic inflammation. And if you can actually get rid of the chronic inflammation, you can get rid of the chronic diseases. So coming back to the same theme is that if you don't want chronic diseases, all you have to do is get rid of the chronic inflammation. And I think there you have it.
Right. On the exterior for skincare,
Yeah,
we've noticed two things, and again, we go through the retailers and beauty brands, so this is bundling with them. It's like consumers can get just a few products that are already SKUs and on the shelf, or they can actually go to the personalized. So personalized in terms of outer skincare is still new. It's a tough thing to scale. Talk about scaling it with supplements. Is it
sure.
tough? Why haven't people done it before?
No. So I tell you what, that underlying technology wasn't there. And secondly, here's the best part.
Okay.
Since we have now done hundreds of thousands of people who have taken the test, we have this massive amount of data that allows us to analyze what nutrients always go together and what nutrients don't. And in what we have really done is now, for example, there are about 200 or 500 ingredients that most humans need as a nutrients. Now
Yep.
we look at your gut and say, okay, out of these 500, you probably need these 40 based on what's going on in your gut. And then we have this machine now that's completely robotic. That say take 22 milligram from the bin number 17, take this 11 milligram from this, and it actually puts it all together, encapsulates it just for you, and that delivers to you on demand just after analyzing what's happening in your gut, what's happening in your blood, what's happening in your saliva. That has never been done. So this whole $1 trillion supplement industry is going to
Yes.
be completely gone, because why would somebody buy something that is actually not designed for them? And that's, I think, is a bigger theme, if you ask me, in healthcare is healthcare is going to be consumerized, healthcare is going to be personalized, and each one of us as individuals are going to become the CEO of our own health.
Yep. Of course.
Because our,
And it all comes together. It's food, it's nutrition,
yeah,
it's skincare. It all blends together. Hey, by the way, not to get too geeky here, but
yeah,
can that machine do hard capsules as well as soft capsules, or is it
absolutely,
mostly soft?
absolutely.
Yeah.
You can do hard capsule, soft capsule, you can do granules, so you can sprinkle them on ice cream, you can have powdered, you can put them in a
Ice
smoothie.
cream. Yeah. Can you, when I do the test, can you make sure ice cream stays on my list? You just lie to me. I don't care. I just don't want to.
Yeah. So what interesting thing is, you don't have to follow the direction. You just get sick and then you do, and then you know. Right. Our job is to tell you what's good for you and what's bad for you, and you get to decide. You want to be. Remember, we said making disease optional. We didn't say getting rid of a disease. Optional means you get to decide whether you want ice cream or not. We can just
I'm
tell you it's
sorry.
bad for you.
I got distracted when you said sprinkle it on ice cream. Okay. You want to take a couple questions? Is that all right?
Sure.
Or just want me to or I can keep hammering you. This one says, what's going on with FDA approvals on all these things that you just described?
Yeah. So first, number
Or
one thing
FDA
is,
involvement maybe is a better question.
yeah. So FDA is not involved in any of the things we do unless we want to make a claim of curing a disease. So if we say we are going to diagnose a disease or we're going to cure a disease, which are
Yep.
specific diseases, then you need an FDA approval. And so by the way, we are working on FDA for oral cancer. We applied for breakthrough device status. That is an FDA device. But
Yep.
in terms of helping you live better, helping you improve your inflammation in your body, helping you reduce your weight, helping you manage sleep better, more energy. These are all wellness stuff, and FDA is not involved. Having said that, we probably have at least 15 clinical trials right now to prove that what we are doing actually works. So we already announced our relationship with Mayo Clinic, where we are actually working with them on
Yep.
obesity and
Yep. Saw
insomnia.
that. Mm-hmm.
And we are also working with Kaiser on diabetes. We are working with the United Healthcare Group on IBD. We are working with Advent Health on depression, anxiety, and population level health. And we are
Right.
working on all the different head, neck cancer, shoulder cancer, HNC cancers, and the GI cancers like pancreatic cancer, ovarian cancer, colorectal cancer, and all the different types of GI cancer. So our thinking is that we want to look at everything that's happening in the human body and use the food as a medicine. So if you were to ask me, as what's my elevator pitch? It is Viome is a therapeutics platform that analyzes the gene expression to prevent and reverse chronic diseases. And we are building these applications on top of the platform, such as the precision supplements. And by the way, you probably saw that we announced a relationship with GSK, where we are actually helping them develop a personalized vaccines for autoimmune diseases and several other diseases. And similarly, we have these trials for autism. So we are looking at autism, what causes autism, and can we reverse autism through food? And there is a very good data that actually shows that even through the fecal transplant, you can actually get rid of some of the autistic behavior. And there was a done at UT Austin. So my point is, now people are realizing that the lot of the diseases are gut-related diseases, and sometimes they are showing it through the fecal transplant, that when you take a poop from a fat person and give it to the mice get fat, and you take a poop from a thin person and give it to the mice get thin. So now, I mean, you get my point. Point is, it's directly causative, not just associative, it is causative. And what they're finding is you can also transfer things like depression and anxiety and many of the chronic diseases. That means now we know it is in the gut microbiome. Can we manipulate and modulate that through our food and supplements? And that's the whole idea, is that can we actually control our biochemical activities in our body using the active compounds in the food and active compounds in the supplements?
Right. A couple other questions. Any patents?
So we have several. I mean, so obviously, as you know, this technology came out of Los Alamos National Lab. There is no way, by the way, the reason no other company has ever been able to do that is, remember, I keep talking about gene expression. There is not a single company that is able to analyze gene expression. They all do the DNA sequencing. There is not a company that can do RNA sequencing, because RNA is unstable. So we have many, many patents that actually
you said gene expression a few times. So that is the way your genes want to react and go and fight, or it's how mine are behaving.
Well, so here's a very interesting one. Think about it. Every single part in your body has identical gene. So why is it that we have teeth in our mouth and the hair on our head as opposed to other way around? It is how the genes are expressed. They can become the lung, they can become liver, they can become heart, they can become hair, they can become teeth. Same genes. How it is expressed changes everything. Between you and I, we have 99.9% same DNA, but what is expressed is what changes. So as we develop a disease, our expression is changing, right? Otherwise, we will all look the same. Otherwise, we will all behave the same. So it is literally about what is being expressed. So the underlying technology was a national security technology at the Los Alamos National Lab. So we licensed the patents from them. And then we probably have several dozen patents that we have filed that actually allows us to analyze not just the gene expression, what molecules are being produced, and use the artificial intelligence on top of that to recommend what exactly the nutrients your body needs. And that nutrients that your body needs is all driven through automatic AI system.
That was another question here. Sorry, I'm looking off screen, but how deep is your AI technology, is kind of to sum up a long question here.
Yeah. So basically, the head of IBM Watson works for us now. Right? So we have a very, very deep unsupervised machine learning, supervised machine learning, and we do and the fact that we now have hundreds of thousands of people who have taken the test, we can in fact predict that you're going to get obese, you're going to have depression, or you're going to have diabetes, or you're going to have IBS, just by looking at what's happening inside your body. Because there's just signatures. You can see the people who have the disease, what are the biochemical activities, and you can see how close you are moving in that direction.
And given your AI that information, there's going to get more specificity around it. It's only going to get better and better, right?
Exactly. So as more and more people are coming and doing the test, every single person benefits from the hundreds of thousands of people before them, and they make every single person better. So this is how the
cumulative science, right?
And it's a flywheel, right? Once the flywheel gets going, it just goes faster and faster and faster, and no one can come behind you. And that's how you scale the company, create the flywheel.
Yeah, two tech guys interviewing each other here. We love the flywheel. Here's another question. How are you working to get integrated with patient's life flow? So how are you actually, like the patient life cycle, his treatment flow, just how are you actually doing this with patients? Is it?
So idea is this is a direct to consumer, and in a sense, a consumer adopts us, and they essentially get on top of what they are already doing. And what we are working with a lot of these things like Kaiser is to say, even if you have a disease, can we do a standard of care, and a standard of care plus Viome? Can we show you that our stuff works substantially better than the standard of care? So if you have a diabetes, can we show you that your diabetes care plus diabetes plus our precision supplements are going to reduce your A1C more than just your standard of care alone? Same thing with autoimmune diseases. Can we do the same thing that shows the people who are taking biologics and people who take biologics plus precision supplements.
Yep.
They don't use biologics as often because we now reduce the inflammation. And that means now they don't have to take biologics instead of every 2 months. They may take every 10 months, every 12 months, or may never take again, right? And that's the beauty. The thing is that once you get rid of the underlying root causes, now I hate to say that in the last couple of minutes, I just want to go on this soapbox, right? Our current medical industrial system, it is so screwed up that everyone in that system makes money when you're sick and no one makes money when you're healthy. So they are fundamentally, when you look at the chronic diseases, to them, all they want to do is suppress the symptom, not cure the disease. Because when they suppress the symptom, they have a lifetime subscriber. And they would never want to get rid of the lifetime subscriber. Whereas people like us come along and says, you know what? I don't want to suffer for the rest of my life. I lost my dad to pancreatic cancer. That's the last thing I want.
They need an alternative to the doctors. That's right.
Exactly my point. So I'm thinking is, why not take control of our own health? And I don't want anyone else to suffer, their loved ones to die from any of the chronic diseases. To me, it's a mission. I am not here to simply build a company. I'm here to give back to the humanity that has given me so much. I came from nothing. I came from absolute poverty. And God has been very kind to us. To me, this is my way of giving back for what I have received from the God as the trustee of his kindness. And I want to make sure that one day we can create a life, Dean, where being sick is truly a matter of choice, not a matter of bad luck. And that's the world I want to live in. And that's the one I want to create and give to our children and grandchildren.
Perfect. One last question here. Let's switch to one of your other companies. The question is, why did you start Moon Express, and what's happening there? What's next? We 2 minutes.
So Moon Express, I started for a simple reason. We are living on a spacecraft.
You're obsessed with the moon. I know that. I've seen all your rocks in your office. This guy has more moon rocks than I don't even know how you got them. I mean, I don't. Sometimes I don't want to touch them. They could be nuclear active. I don't know. You've got them in plexiglass things. That's not enough protection for me.
But the point is really, I mean, you have to be a multiplanetary society because all humanity is at risk. If we get a large asteroid hit us, like dinosaurs, we'll all die. So idea is, why can't we live on the moon, Mars, and beyond? And, it is not about how do you grow the food on the moon, which is what everyone keeps saying. Hey, if you go to the moon, how are you going to grow the food on the moon? And to me, that's the wrong question to ask. The right question to ask really is, why do we eat food? Because we eat food to get nutrition and energy. And what if we can get the energy and nutrition some other way? Then we don't have to worry about growing the food. And I believe in our lifetime.
You're talking about mining materials?
Mining materials, or even just living, creating a multiplanetary habitat on the moon as a base, and then going to the Mars and going beyond. Because there is no reason every one of us has to essentially be on a single spacecraft, and either we will damage our own spacecraft or someone else will damage it for us. Then what? Because if you could hear any dinosaur rolling in their grave, what would they be thinking? If they had one good entrepreneurial dinosaur, they would be roaming on the moon, Mars, and beyond. So why be a dinosaur? Why not be the great human?
Yeah, they didn't have spacecraft. I've got some airline food jokes here that I'll hold back on. So don't you have rights to actually take things off the moon? Don't you have one of the agreements there? What's that all about?
So we actually have, NASA awarded, about half a dozen companies $2.6 billion contract. And by the way, we are the only company in the universe that has permission to leave Earth orbit and land on any celestial body. And the President Obama signed into the law that says anything we bring back from any space object, we get to own it. And that's an amazing thing, that we can bring back anything we want, and we actually have a clear ownership of that material. So to me, moon rock could be the next diamond, right? As you and I talked about it about 10 years ago, you asked the same question. What will happen? I said, imagine if the moon rock became the next diamond. Instead of promising somebody the moon, you give someone the moon. So as opposed to say,
you can see I can see the Hallmark commercials now. Exactly. Oh, honey, you just promised me the moon. I actually want it this time. Yeah. No, I get it. Now, and by the way, all the materials up there kind of relate to what you're creating in these new drugs and supplements. I think someone's going to find some rare material up there where we don't ruin the moon, but actually take little bits of it out that could save lives or do things or make farming much, much better.
and also I think you can crystallize in the low gravity the drugs crystallize differently, and you can actually create the drugs that could be substantially different than how we create them on Earth.
Exactly.
And that could essentially be a completely different compound. So pretty exciting stuff. I mean, to me, at the end of the day, we are living in the most innovative decade in the human history. The next 10 years are going to fundamentally change the trajectory of how humanity is going to live, and they're going to thank you. And someday, and every one of us, of what we have created is going to change the way people live their lives. And that's the way to live their life. That's the way to live our lives.
Great way to leave it. Thanks, Naveen. We really appreciate you coming on. Everyone, join us our next episode just in 2 days. We're going to have the CEO of Cameo on and learn about how Hollywood is responding and replying and helping people in need during this coronavirus pandemic. It's going to be kind of a fun show. Thanks again, Naveen. Cheers.
Looking forward to the next show, brother.
Let's do it.